Christine, I brought you here today because I want you to talk to the wives of the patient of the prostate cancer suffering males. And for the wife, it's got to be rough. She's concerned about her husband's health and future. She likely feels helpless, anxious, and looking for a way to protect her husband. He's been diagnosed with prostate cancer. It's a very confusing time. How did she get here? Why is she watching this video? What is she looking for?
She's probably looking for support. She's probably looking for as much information, pretty much ammunition. How is she going to be the best support for her husband? How does she give him the strength to get through this journey? And also, chances are, by the time they've come to us, it's because they've already heard from several specialists already. They might have already gone through 2, 3, 4 different opinions, right? So they're coming to us now because she's like, I heard about Theranostics. Can you tell me a little bit about this?
Okay.
And should my husband have a prostatectomy? Should my husband agree to go ahead and have chemotherapy? They've put him now on some type of hormone injection. He's not feeling good. He feels like he's on a ship. We've just been told that these are the steps you have to take, but I feel that I want my husband also to have quality of life. What are we really dealing with? Is this really the only other option we have? I don't want him to suffer from all the side effects that we hear that prostatectomies actually do to a man. And so this is why they come to me. They come to me because they want to know a little bit more about Theranostics. They want to know, tell us a little bit about targeted therapy. Tell us a little bit about precision medicine. Tell us why this is the best option.
Tell me a little bit about, because I know wives are fantastic at research.
Yes.
Tell me a little bit about the FDA is only related to insurance.
Yes.
I know that's got to be a question that they want some more information on.
Correct. The type of therapy, radio-ligand therapy, which is, the Pluvicto lutetium-177, is administered to many, probably big name facilities out here in the United States, right? But the FDA has approved it. However, the insurance companies here in the United States will only authorize that type of treatment if and only if, say, for example, you have undergone so many rounds of chemo, undergone then radiation, has been on hormone treatment therapy, and still your PSA level is rising. But however, you'd be surprised how many patients don't fall in that category. Every day I'm getting patients that are coming in younger. I mean, for the last 2 weeks, I literally have had 3 patients that are coming in at a very early 50s age, not your normal senior male that comes in at 65 and up.
It's starting to change.
It's starting to change.
Now, her husband's probably been told to wait. He's been recommended invasive treatments.
Yes.
She knows every day matters. She wants to help him avoid unnecessary suffering. She wants to avoid getting his prostate removed.
For sure.
I'm sure for a couple different reasons.
Yes.
And some personal.
Yes.
More than others. But there's a better, less invasive treatment right now called Theranostics.
Yes.
Do you want to give her just a basic idea of what Theranostics is so she can understand a little bit better?
Absolutely. So Theranostics stems from therapeutics and diagnostic.
Okay.
And basically what they do is they go in and they infuse this, radioactive nuclide in the system, and they combine it with an imaging, which they have already had their prostate-specific
Isn't that kind of
membrane
like what
antigen.
you do when you go get an X-ray? They make you drink the barium enema so it shows up on a picture. And,
Yes.
Okay, so this is nothing brand new. Okay.
Right. The wonderful thing about it is they do this in combination, and because we want to see the metastasis, right? We don't want to go in blindly.
Right, and just start wiping out the whole forest.
Right. So we want to see where the metastases are. That's why that PSMA PET CT scan is so important, because if it lights up like a Christmas tree, that's when we know exactly where all the targets are. So then we go in and they infuse this therapy and they
just
get
goes
it.
right after only the problem cells.
Correct.
That's fantastic. Well, let's talk about her. She's nervous about her husband, but not just that, but the process as well.
Yes.
Can she free her husband from anxiety and pain that he's experiencing? First, I mean, is this going to be a less problematic process than going through the insurance and going through all the regulatory? Is this going to be a little easier on time?
It will be, because they have two options. Sure, if they meet the age criteria and the other potential, the other types of
Thousands of.
yes, treatments that they've already been recommended that they do. We actually have patients that say, we're not going to wait to see if they're going to, if the FDA, if the insurance is going to authorize it. We already know, because he doesn't want to undergo any more chemo. He doesn't feel good. He doesn't feel good. He is not eating. He's not sleeping at night. He's almost angry all the time. I don't know how to help him. This is exactly what my patients' spouses are saying to me. I don't know how to help my husband. Can you please get us to the facilities that can do this treatment? Well, the only facilities that are doing this are the ones that are out of the country. Even though it is not FDA approved in their country, but they are doing it. They're doing it because they're allowing the patient to sign consents. They're informed consents. They are educated about the type of treatment they're going to receive.
Okay.
And the results have been astounding.
I've read online, there's quite a few.
They're astounding, but we can't offer that here in the United States.
Right.
So we do have to reach out to our partnering and affiliated facilities that are in other countries, and they are able to get them on the schedule, and they can get on a plane and get this treatment immediately.
It seems like a lot of less red tape,
Yes.
a lot less corporate policy.
Yes.
Can he have immediate access to top-notch care?
Absolutely, because only the best are doing it in the other countries.
Well, for the sake of her husband's future, she should probably schedule a consultation. Now, how much is this consultation going to cost her at one of the bigger hospitals or one of the bigger corporate entities? How much are they usually charging for a good consultation?
For a consultation of this diagnosis, for that level, it's a lot of time. It's usually even an hour, if not more. My chief medical officer has spent literally an hour and a half, almost 2 hours with patients, depending on their history and the level, what stage this patient is at.
Okay.
But it's about minimum a $2,000 charge for this type of consultation.
Okay, so to the wives out there, so they can understand plainly and clearly, how much are you charging for your consultation?
Our consultation is free. If they do not live in the same state where our clinics are based out of, we can actually even do a Zoom. And my medical director will actually be the same as if it were in person. He would never rush the visit. He wants to get the total history. And then we talk about next steps and customize a tailored treatment for him.
when all they have left is a little time and a lot of hope, she's got to give her husband the gift of time and hope. And now she can do it.
Yes.
And all she has to do is call, what, a toll-free number?
They can call a toll-free number or they can call me directly.
Okay, well, if you want to get this done and you're worried about your husband, call the number on the screen and talk to Christine.
Absolutely.
And she will help you get this done a lot faster.
Yes.
And with a lot less worry and problem, which I believe the anxiety and stress it's got to be just as bad as the cancer, doesn't it? For her?
Absolutely.
Talk about her experience dealing with this time issue.
Well, just like cancer doesn't sleep. Well, neither do the spouses, because they're worried. They're worried and they feel helpless, and they feel like now they need a team. They need the right team that's going to support them. And that's why I tell them that they can call me at any time. They can call me at any time because, again, they have anxiety. They're not sleeping. They're thinking of everything possible to help their spouse through their journey, and this is why I feel that we stand out above any other facilities. We are literally here for them at any time.
Wow.
And remember, we have facilities, of course, while everyone else is sleeping, they're awake and they're treating our patients. So I get those calls too at 2 a.m. when our patients are checking in for their treatment in Australia or in Magdeburg, Germany, or in Bad Berka, Germany, or in Anadolu, in Turkey. So our facilities, literally, they're around the clock, and that's why we're around the clock for them.